Hey everybody, thanks for joining me, Dr. Ross Marcagiani, with another great Word of the Week. Today's Word of the Week is going to be heavy metals. Not the heavy metal rock band, the heavy metal, the elements. A little bit of a dad joke there, but we're going to dive into what are heavy metals, what can they do to our body, how we test for them, and how we reduce these toxic burdens. Let's dive in. So, what is a heavy metal? So basically, heavy metal is we know that they're on the elemental chart. There are actually 35 metals on the elemental chart. 23 of them are considered heavy metals. And these metals actually not are all bad. Some are good, some help enzymatic processes, and some help other aspects of the body. For example, zinc is incredibly crucial for immune function. Manganese is really important for neuronal function. Copper is helpful for joint or ligament integrity. So iron is really crucial for holding on or binding oxygen. So some of these metals are very helpful. Just if we have chronic exposure or acute exposure where you get a large exposure of a heavy metal recently will create heavy metal toxicity, or that chronic exposure can build up to heavy metal toxicity, and that's something that we want to be aware of. You can see here some various heavy metals. The big ones that we want to be concerned about are arsenic, mercury, lead, cadmium, silver. Those are the big ones. Those are the ones that are that we should be concerned about. Chromium's up there as well. Chromium gets talked about, but again, not all of these are always bad. How they affect our bodies, what happens is as these metals accumulate and get stored into tissue, whether it be fat tissue, whether it be nervous tissue, whether it be in bone or other organs, they induce oxidative stress. So they basically create chaos, and then as oxidative stress generates free radicals. So I know people have heard me talk about free radicals. Basically, they bounce around and they make more chaos, and they remove an electron out of the outer valence shell of that atom, and it creates more chaos. But just know that oxidative stress creates chaos, which generates free radicals, which can damage our DNA and create cancer, can damage our protein and cause our protein to be unfolded or not folded correctly so that the protein can't function. They can damage our blood-brain barrier. They can damage our lipids. So like lipids make a lot of the outer shell or outer casing of certain tissues, and that can be damaged. And they can reduce our oxidation levels because it creates more inflammation. So there's a lot of things that can happen here with heavy metal exposure. So what could heavy metal toxicity cause? So again, we can have acute or chronic heavy metal toxicity, and it can cause cardiovascular disease. It can cause neuronal damage. Again, remember we talked about the damage of that damaging lipids. There's something called our blood-brain barrier, which protects our brain, which is made up of phospholipid bilayer. And if metal gets into that blood-brain barrier, it can damage that and actually allow metals to pass into the brain or diffuse in the brain. There's a pathway that they can bind to called calmodulin, which can enter into the brain, and we can see connections with Parkinson's, Alzheimer's, dementia, some serious neuronal issues, autism even. It can deposit in various organs, so we can have renal damage. We talked about the ability to affecting or damaging our DNA, increasing risk for various cancers, whether it's renal, liver, lung, bladder, prostate, various cancers, and it can increase the risk for autoimmune conditions. You can see the link here below to read more about the connection with these various conditions. And then, so how we test for this. Before I get into that, how would someone be exposed to this is what we're going to dive into in just a moment. But how would we test for this? So some say it's not accurate to test blood. Blood only shows you an acute exposure because a lot of these metals should be deposited into tissues and other organs. But you can do blood, you can do urine. Urine is a really good way to see what you're excreting out if you're removing metals. You can test the stool, again, a good way to see what you're excreting out and what your body's removing. You can look into your hair as well, do hair samples, see what toxins or metals you could possibly be sweating out, and that could be in the hair follicle. Same with the fingernail. The gold standard is to do a 24-hour urine catch and use some type of agitator that removes some of these various metals, such as using like EDTA, DMSA, DMPS. These are chelating agents, which we'll talk about a little bit more here. But again, the gold standard test would be doing some type of urine catch along with blood, and then also possibly doing the EDTA, DMSA, DMPS, which there's a little bit more restriction on using that, but at the very least, doing a urine sample and or doing blood work to see where your heavy metals are at. So how do we lower this burden? So we want to be aware where we're getting exposure of metals. So we can get exposure of metals from the mining of ore, which can then precipitate into the air or into our water, where it then can be transported. Our atmosphere and our Earth's crust is very high in these various heavy metals. We can have a lot of them in our pesticides, in herbicides. We can have them in actually like cereals or our foods or cosmetics. Lead has been since about the 1970s, I believe, when it was banned, was in gasoline. So we can have it in our environment. We can have it from exhaust, being exposed to metals, specifically lead. Arsenic is very high in rice, so being aware of that. We have various adjuvants, such as our mercury in certain vaccines. Now, I know there's some debate about inorganic and elemental and methyl mercury, comparing those three. But again, just being aware of large game fish like your tuna, staying closer to more smashed fish, so your salmon, your haddock, things that won't accumulate, your smaller game fish that won't accumulate as much mercury. We want again, we talked about how it can off-gas into water, or water can have high contamination of these metals, so making sure you're getting a filtration system, or at least having your water tested. A lot of your job, your environment, depending what you're around. If you're around a lot of an industrial work, that can be increase your exposure to metal toxicity. So these are things that you want to be aware of here. So one way to lower your burden, IV chelation, like we talked about with using the DMSA, DMPS, other chelators such as that will help to remove that. You just have to be careful, because that can also start to chelate some other ions, and it can affect your heart and other aspects like that. So you just want to make sure you're doing that very safely. Some more natural ways to chelate various metals: you can use humic and fulvic acid, you can use cilantro, silica, chlorella. Glutathione is really helpful with the binding, removing of metals. Citrus pectin is another one that's very helpful. So improving your detox pathways and pushing detoxification. If this is something that you want to get tested on, or make sure your detox pathways are operating optimally, please don't hesitate to reach out. But these are some key aspects that I would do and look into. I really appreciate your time. Thank you for watching this video.